Hi, I'm Chris Nedza, Lead Entrepreneur in Residence of the Advanced Technology Development Center at Georgia Tech. We're the state of Georgia's technology incubator. Welcome to Season 1 of the ATDC podcast, Executive Bytes. We focus on the startup founders in our portfolio, what sparked them to launch their companies, the market problem they've solved, and even how they overcame the thoughts of quitting when times get rough. Enjoy. All right, welcome back to this episode of Executive Bytes. Today, I've got Chris Appleton of Art Pharmacy and Jan Norris. Okay, so before I get to you, Chris, so it's Jan Carl Norris, but you are known as Chuck Norris.
In certain circles, yes.
Yeah,
correct.
Well, in my circle you are, because you're a two-star general, and it just seems to go with a Chuck Norris kind of thing, don't you think, Chris?
Yeah, I'm curious, are your martial arts skills as...
Zero.
Okay.
Zero. But he does triathlon, so he's a beast. But Chris... So Art Pharmacy just joined ATDC's signature program. So and the reason you guys got into that program is you are taking off like a rocket ship. I mean, you've got something that nobody else is doing, and you're executing with just complete excellence, and you're growing like crazy. So I'm fired up that you're in our program, but more fired up to share with our audience what you're doing, and then we're going to dig into a lot about you. So let's start with, tell me about Art Pharmacy.
Thanks for having me, and grateful to be included in the signature program. Art Pharmacy is a 3-year-old company that gets in the mental health space. We connect individuals with issues related to anxiety, depression, substance use disorder, social isolation and loneliness to non-clinical community supports in the forms of going to a dance class, taking a ceramics workshop, going on a guided tour at your local botanical gardens, leveraging the science of arts engagement and arts participation with really thoughtful care models to support people's mental health.
Okay, so you started 3 years ago, and I just blurted out that you guys are growing like a rocket ship. So can you give me any example about that? What does that mean to this audience?
Sure. What we're doing resonates with people. There is a mental health and loneliness crisis in the United States. No one has to be convinced about that. It is headlines every single day in the news. And there are not enough providers to meet that demand. We can't train and hire our way out of the crisis. Not enough therapists. And we have to get new types of supply into the marketplace to address those challenges. Those new types of supply address the supply-demand issue, and there's an acceptability issue. Even though stigma is improved around mental health, a lot of people don't want to go sit in a therapist's office. A lot of people don't want to be on medication. We're not trying to suggest that what we do is a substitute for medication for people that need to be on antidepressants, anti-anxiety, antipsychotic medication. But it certainly is an adjunct or supplement for those that are. And maybe if you're a little bit earlier stream, to try to prevent some of those more serious, persistent mental health illness concerns, that's where Art Pharmacy fits in. So I think our growth is just about how much it makes sense to people. What we do is we connect people to in-person human connection activities. And no one in the world right now thinks that we need less in-person, less time with others.
Right.
Everyone says maybe we need to get off of our phones a little bit and spend more time with other people. And that's really what we enable. Obviously, technology plays a big role in what we do in this kind of matching algorithm, connecting people to the right activities.
But how does art come into play?
So we have a national network of arts and culture partners that are your local theaters, museums, dance studios, community arts organizations that are already providing activities, going to a play, going to a ceramics workshop, going to a dance class, already providing activities with protective and therapeutic benefits to people's health. They get vetted onto our platform, and then our members, individuals that are referred to us by therapists, primary care providers, directly from health plans. We connect our members to those activities to support their mental health.
Yeah. So how are these art care providers vetted? Are they? Is there an industry standard that they're analyzed or matched against before just any random dance studio is selected? How does that work?
Yeah, that's right. So there's a standard of care.
Okay.
All of the partners have to meet that standard of care. They go through quality protocols with us. Mm-hmm. There are centers, kind of the way that our Art Pharmacy got started I was introduced in 2019 to the arts and medicine research field. There are centers for arts and health and arts and medicine at Harvard, Duke, Hopkins, UCLA, University of Florida, Northwestern, World Health Organization. For about 40 years, scientists have been studying the role of arts participation on a range of health issues, from its impact on chronic illness to mental health across the lifespan. And there's a wonderful evidence. The science is great. And but it's particular types of art activities that are best fit for particular patient profiles and health needs.
Okay, so the stock market crashed the other day pretty bad, and I got depressed.
Yeah.
What do I do?
Hang on.
From prayer,
hang on.
Prayer.
Hang on.
Do I go to artpharmacy.com, or or is this too basic of a question?
Yeah. We should all every day be doing things that strengthen our resilience.
Okay.
When hard things happen.
Not if. When.
Not if. Yeah. So stock market crashes. You lose a loved one. Something hard happens at work. You learn something about your health that's challenging. Like, life happens, right? Half of all people in the United States will be diagnosed with a mental health disorder in their life. Half of the people.
Wow. That means somebody here.
Absolutely.
This audience.
Absolutely, right? So the most important thing to do, I think, is to develop habits and skills so that when life happens, that feeling of depression doesn't turn into a sustained issue that really disrupts and interrupts your ability to.
So is
life.
your customer the patient? Is it a center? Like, I guess what I was really going at is, do I go on artpharmacy.com, sign up for an account, or tell me about that?
So we are not direct to consumer. So we sell to managed care health plans, universities, risk-bearing health systems, government agencies who have a responsibility for their population's mental health and well-being.
Okay, gotcha.
So the health plan determines, just like most other mental health interventions or healthcare interventions, the health plan determines who's eligible, what's an appropriate population to serve, et cetera.
Gotcha.
Yeah, Chris, you mentioned the stock market, right? Plunging. So I'm curious to know, for many years, my experience in the military with things like chiropractic, with the care that I was provided, well, we don't cover that. After some time, it became a more a founded approach to treating pain, and then it was covered. So I'm curious with art, are you finding providers that are covering this, or for example, I have TRICARE. If I go to you, are you going to say, well, TRICARE doesn't cover it, you're going to have to copay? What trends are you seeing with providers who are accepting this form of
good
therapy?
question.
Yeah, it's hard work to develop these contracts, right? There's no code. What we do is called social prescribing, right? Your healthcare provider prescribes non-clinical community-based activities.
Right.
There's no code for CPT code, billing code for a social prescription that the Centers for Medicaid Services has issued. So what we do is develop custom contracts with these health plans and other customers that make it available. So generally speaking, a person can't walk off the street and go to their health plan or their provider and say, I want a prescription, give me a prescription. It's really through these partnerships that happens. Now, I love that you used chiropractor as an example. The example that I like to use in thinking about this is, and this is a silly thing to say in 2025. I feel embarrassed sometimes when I say this. 40 years ago, we did not all know that our health outcomes were connected to our physical activity level. We didn't know that. In 2025, of course we know that, and every doctor and health promotion program in the world says be more physically active, right? Exercise, walk, go on a hike, bike, whatever it is. But we didn't know that 40 years ago in the way that we know that today. And 31, 32 years ago, an amazing company that you're probably familiar with, emerged called Silver Sneakers.
Oh, yeah.
Silver Sneakers is a national network of fitness programs for older adults. And they had this big idea, again, 30 years ago, they had this big idea. Well, what if we got seniors on Medicare more engaged and active physically? Could we improve their health and reduce cost of care for that individual and for the health system? Right? And it worked. They went public, multi-billion-dollar company, And it's a national network of fitness programs for older adults, right? I don't mean to like, that sounds kind of simple, right?
Yeah.
Well, I feel very sure that in a generation, 3 guys like us are going to be sitting around saying, remember, we didn't know when our engagement with art, culture, creativity wasn't connected to our health outcomes?
It's going to be, okay, gotcha.
That, like, that's sort of the roadmap for us, and to chiropractor, or, is another great example of, at some point, these new interventions and the science that support them make their way into the marketplace.
Yeah, great.
Interesting.
Yeah.
All right, let's flip it a little bit on the topic. So, was there an event that caused you to start Art Pharmacy, or did you just kind of cruise into it?
It's never a straight line in these sorts of stories, but I spent 15 years building and running arts-related businesses, and through that work was seeing every day the power of engaging in the arts on people's health and well-being. I don't know that I had the language for it at the time that I do today. And also through that work was introduced to this arts and health field that I referenced earlier, this research field. And I said, there's all these centers, all these, world-class scientists are studying this. The evidence is clear. Why the heck hasn't U.S. healthcare bought this, right? And that was kind of the question that really led to the birth of Art Pharmacy. Of, if coming out of the pandemic, major mental health crisis, so much demand for services, increased clarity on how untreated mental illness impacts our physical health and total cost of care for healthcare payers, why hadn't U.S. healthcare bought this? And that's really what
got you going.
Yeah.
So I know you're not selling directly to the consumer, but have you heard any life-altering testimonies or anything like that? Do you ever get a chance to hear or feel that?
Every day.
Yeah.
We have we got this great Slack channel
every day.
Every single day. We've got this
awesome.
great Slack channel that feeds our team patient testimonials and member feedback, and every day I get these messages.
Is there any one that you can that touches you?
And this is actually here in Atlanta. One of our partners is Grady, and the Grady Cancer Center.
Oh yeah, right.
Individuals that are going through cancer treatment, right? You get diagnosed with cancer, going to have a pretty big impact on your mental health, your ability to stick with your care plan, right? Your cancer treatment plan, impacted by your mental health.
Yeah.
We get one patient in particular, and this is just, I don't know, maybe a month or so ago, said that their engagement with Art Pharmacy is what allowed them to persist through that plan.
Yeah.
Like, forget the business side of this. Going to work every day is like the greatest thing in the world.
Yeah, anybody can go to work, right? No, I love that. I love it. So you're definitely building something bigger than you, which I love. I think that's awesome. But it's not easy, is it? Ever feel like quitting?
I do not ever feel like quitting.
Really?
I do not ever feel like quitting.
Okay.
I got plenty of energy for this, but it is not easy. I say to people, basically no one in the United States woke up this morning thinking, I need to buy art prescriptions. Right?
Right.
Like that is just not,
I didn't do that this morning.
Exactly, right? So there's a lot of education that has to happen to introduce this concept and then help people understand not just the science of it, but the operation, like how it is operationalized, which is a big piece. The arts and culture field, going back to the kind of market disequilibrium on the mental health side, more demand for providers than there are available providers. The arts and culture field kind of has the opposite problem. Like no museum or theater in America would say, don't send us more audience.
Right.
We can't handle more people. It's the opposite problem. In the arts and culture field, they typically build the supply before the demand is really there for it. And so, a big piece of what we're doing is solving, kind of one part of that ecosystem's problem with the other's problem, and it marries itself very well. But there is a lot of education that has to happen,
right?
Which I enjoy doing. Right? I mean, what better thing to do than to get out there every day and talk about how this matters.
Yeah, and as you start to accelerate now, as I'm hearing today, what in terms of markets geographically, I think about rural areas versus urban areas where they may be more challenged to have access to the arts, out in the middle of Kansas or Alaska or even Idaho. How are you approaching?
No art in Idaho?
Depending on where you live, maybe some animal life around you. But
right.
So is there something you've thought through in how you would deal with those type of scenarios?
We do. So we currently serve members in Georgia, California, Massachusetts, New York. We are rolling out in Connecticut and Arizona right now. We're statewide in Georgia, statewide in Massachusetts. We got dense urban areas in these places, and we got rural areas in these places. Of course, there are challenges in rural areas that are not unique to, where's the arts and culture in this small town in Western Massachusetts, but also where's the healthcare provider in this small, right? Like we hear about access to healthcare for rural communities is similar challenge. However, what this does, and one of the ways that we meet that challenge is certainly through virtual engagements.
Right.
But the other is most small towns, they may not have a big museum, but they've got a community center, they've got a library, they've got these cultural centers that maybe don't present on the face of them as an arts, as a cultural institution, like we may have in Boston or Atlanta. But these activities are happening at those places, and part of what our team does is goes and, again, qualifies them, vets them, and helps that local community find where this medicine already exists.
So I just got to ask you, how did you leap from Georgia to the next place, Massachusetts?
Two very similar places politically, and
Yeah, right. Nothing alike,
Yeah.
Did you go out to Bahaba?
We had a partner in Massachusetts that recruited us there. We need
Got it.
When we go to a new market, we need an anchor partner that makes it worth it for us to go do that upfront work to build essentially a provider network. And we had a partner that enabled us to do that in Massachusetts. That once we're there and you build the network, that network becomes available to all the other customers and members that we have there.
Any words of wisdom you would give a startup person?
You better be in it for the long haul. It is not for the faint of heart. To go back to this kind of Art Pharmacy origin story of this question of why hasn't U.S. healthcare bought it?
Yeah.
There are really good reasons U.S. healthcare hadn't bought it, right? There are really good reasons, and overcoming those reasons is real work. Starting with understanding your customer or theoretical customer's problem is so essential.
Yeah.
And not making a product and then saying, hey, everybody should buy this because I like this product. I mean, I think that is one piece of advice.
That's great. I think you're right. I mean, a lot of people just fall into that fallacy of, I've got the magic mousetrap or whatever, and you figure out that.
And some do, right? I mean, some do, but most don't.
Yeah, just because your mom buys the product from you doesn't mean the market will, right?
I think I think team like love the people you work with because it is hard every day.
Mm-hmm.
I tell our team every day, our goal is that there is more work to do tomorrow than there is today. That's literally what we're trying to make happen. That there's more work for us to do tomorrow than there is today. And we don't have enough money, enough time, enough people, there isn't enough to do the work today, and we're trying to make more work. So you better love the people that you work with.
That's a good one. Well, listen, Chris, thank you so much for being my guest today. And Jan, Awesome.
Yeah,
spending
great
time with you.
conversation. Yeah.
Thank you all so much for having me.
Yeah.
Thank you, Chris. Thanks.
We love your company. Love what you're doing. Thank you for joining us on this episode of the ATDC podcast. Please subscribe to our YouTube channel, like, and share or connect wherever you get your podcasts. Please be sure to follow us on social media. Our handle is @ATDC on X, LinkedIn, and Instagram.